Testing 1, 2, 3.
Yes, your test is successful. صلى محمد وعلى محمد.
اللهم صل على محمد وآل محمد. أعوذ بالله من الشيطان اللعين الرجيم. بسم الله الرحمن الرحيم. وقل جاء الحق وزهق الباطل إن الباطل كان زهوقا. صدق الله العلي العظيم. Brothers and sisters in Islam, thank you very much for your attendance tonight, and thank you very much for the introduction, sister. As you can, a chair? No, I'd rather stand. That's fine. So as you can guess, I'm not a medical doctor or a medical health professional. So how did I come to want to talk about this topic? Basically, in a nutshell, personal experience. Many years struggling with issues around healthy eating, weight, receiving a lot of conflicting information, and then members of my family developing conditions like diabetes, being put on cholesterol-lowering medications, sort of obliged me to start doing some research and to start asking questions. And 6 to 12 months later, this is really where I have come up to in terms of a conclusion. I felt so compelled with the knowledge that I guess I didn't discover, but I uncovered, that I felt it was morally obligatory upon me to share it with the community. We have a small gathering here. That's okay, inshallah, the message can spread to family and friends. So we're going to talk about health. Now it's important at the outset to cover ourselves legally. We're not here to give medical consultation. The information I'm going to be including tonight is strictly for educational purposes. It is not a substitute for your doctor's advice. I'm not here to give people health advice. I'm here to give educational knowledge. And if something I say moves you or you want to make some changes, by all means, have a discussion with your doctor and see what can be done. Under no circumstances should you stop taking a prescribed medication without the supervision of your doctor or a knowledgeable health practitioner. Okay. So we need to, when we're talking about any topic, have a guiding principle. We need to have a compass to guide our discussion, otherwise we're just free-floating in the air. And the principle is a prophetic one, and there's no better time. We are celebrating the birth of the Prophet, sallallahu alaihi wasallam, and the Prophet actually gave us a gem, a piece of advice within which there is an entire universe of knowledge. The Prophet sallallahu alaihi wasallam has said, "Al-ma'idatu baytul adwa, baytul da, wal-himyatu ra'si kulli dawa," which translated roughly is the stomach or the digestive system, the gut, is the home for all disease, all illness, and abstinence, meaning forbidding yourself from things, not touching things, not consuming things, abstaining from something, is the head of every remedy. Now, did you know that about 80% of your immune system resides in your gut, in your digestive tract? Who knew that? 80% of your immune system is in your gut, right? So we don't need science to say, wow, the Prophet got it right. No, that's not what I mean. Of course the Prophet ﷺ got it right. I'm not citing that to prove that, but I'm citing that just to confirm that there isn't an illness known to man where the digestive system, where your stomach doesn't play a role. Any illness, even HIV, AIDS, there is a role for nutrition. Autism, there is a role for nutrition. All diseases. And I guess the second thing I want to highlight at the outset is we need an open mind, because what I'm going to do tonight, inshallah, is lay bare many of the things that we've been taught as facts, which are in fact, and I'll say it, are in fact lies, corporate lies. Mark Twain, a famous American author, said it's easier to fool people than to convince them that they have been fooled. And what he meant by that is, once you're fooled, once you have an intellectual or psychological attachment to an idea, and then a man comes along or a woman and proves it false, many people will reject or will react against that person, because we don't like to be proven false. We don't like to feel that we've been taken for a fool, that people have lied to us. So he's saying it's easier to fool people than to convince them that they have in fact been fooled. I don't want you to fall victim to that psychology tonight. What I'm going to do tonight, and there's a lot of information, so please bear with me, try and keep an open mind. Basically 4 points. I want to look at the epidemic in numbers. An epidemic is basically a disease which affects a huge number of people, in a nutshell. That's what an epidemic is. So we want to look at some stats for Australia. We want to have an understanding of the biological mechanisms. You do not need to be a medical doctor or have a science degree to have an understanding of the biology of disease. If you dedicate some time, some research, you can often become more knowledgeable than a treating doctor about a particular condition because you're dedicating a lot of your time to reading about it, okay? It's not that hard. We shouldn't feel inferior. We should be partners in health with our doctors. It should be a balanced relationship, not a hierarchical power structure where you're on the receiving end of intervention and you have no say. So we're going to look at stats, we're going to look at biological mechanisms, we're going to look at the nutritional public health policy. What public health authorities have been telling us for 30 years and whether it's really true, what does the science say? And then the logical conclusion of that, I won't even have to say it, there is a drug-free solution to these problems. If you understand the mechanism, if you understand the science, then the solution presents itself. So let's start off with obesity. It really is a huge problem. Obesity is technically defined as a BMI above 30. It's an basically extreme weight gain. 60% of Australians are overweight or obese, so 3 in 5. 25% of children, you just have to look around you. How many children these days are displaying signs of obesity, abdominal obesity? A quarter of our children are overweight or obese. In another 12 years, 80% of us will be overweight or obese. And this is the first generation in human history in which children, a substantial subset of children will actually die before their parents due to this condition. Now, that's a very scary thought. I've just become a father in the past month. The most unnatural thought for a parent is that their child would go before them, isn't it? You never expect it. You expect that your kids will live on. This problem will lead to, within our community, kids passing away before their parents. This is very serious. If we look at diabetes, diabetes is a metabolic problem which a person's body no longer can regulate their blood sugar levels. So blood sugar levels go too high, go too low, they're quite unbalanced. I'm going to go into the mechanism a bit more, but with diabetes, in Arabic we call it sikkari. Around 300 Australians are diagnosed every day. 1.7 million Australians are diabetic, the majority of them type 2, which means it's the type of diabetes which is related to lifestyle. It's a self-inflicted disease. It's not type 1 diabetes, which is an autoimmune disorder where the body attacks the cells of the pancreas, so you can't produce the insulin. 1.5 million of us are pre-diabetic, so we're sitting ducks. We're on the cusp. We're about to graduate to becoming diabetics. That's a huge chunk of the population. 5% of all pregnancies are now affected by diabetes, a condition known as gestational diabetes, which can have massive complications for mum and baby. Very common. 60% of diabetics have heart disease and will die from heart disease. And diabetes costs the health budget around $1 billion. Costs us $1 billion per year. So even if you don't care about the biology of it, it's taxpayer money, $1 billion a year in health costs. Direct health costs. As you can see, the prevalence of diabetes has absolutely skyrocketed in the community. Prevalence means the number of people in the community who have a disorder. It's different from incidence, which means the number of people diagnosed with that disorder in a period of time. So you can see that around 1989-90, the prevalence of diabetes was about 1.5%. 20 years later, it's creeping up towards 5%. It is skyrocketing. This is very concerning. In 1992, there were 1.6 million scripts issued for diabetes medications. In 2011, 7.1 million scripts. This is information from the federal health government, from the pharmaceutical benefits scheme. That's an increase in 443% in 20 years. What's going on? In 1992, there were 452,000 scripts for metformin, a